guys, welcome back to my channel. If it's your first time here, be sure to go ahead, subscribe, turn on your notification bell and join the family. I hope everyone is having an amazing day. I hope you all are doing well, and if you're not doing well, I hope you're doing fair and your loved ones are doing just the same. So in this video, I want to talk a little bit about, is healthcare really free in Jamaica? Time and time again, I've been seeing people commenting, but healthcare is free. You can go to the pharmacy and get your medications for free, partially free. Healthcare is not entirely free in Jamaica. And what I'll be talking about is, do I think healthcare should be free entirely? Now, just to highlight a few things about the healthcare system in Jamaica, for the government hospitals, there are certain things that you do not have to pay for, but at the end of the day, there are things that you have to pay for, like if you want to get an MRI, if you want to get an ultrasound, there are certain blood tests that you have to even pay for that is not covered by the government facility. Additionally, also, if you have certain chronic illnesses, especially terminal illnesses, those are not covered by the healthcare facility here in Jamaica. It's not covered under the NHF, which is the National Health Fund, and that is what provides free healthcare, free medications. So let's start with myself first. My personal experience with using the free healthcare system. Now, with using the free healthcare system, I've tried it times and times again, and each time that I've tried it, it really doesn't work. Now, for those of you who may not be aware, I have another channel where I talk about my struggles, my medical health history, and my current conditions. So if you want to find out more about that in depth, you can head over to Chosen Natural Health Corner, but after this video. So, at present, I have hyperthyroid disease, which I've been living with for quite a number of years. Now, some of the challenges that I face with having hyperthyroid disease is insomnia, low energy. Sometimes I have basically no energy to do anything. And also another side effect is depression. And you may have a skin condition, which might be either hives or shingles, you name it. Because once you have an autoimmune disease, what it does, it attacks your immune system. You may end up with like dry, scaly skin, which I had initially at the initial stage of my diagnosis when I didn't know how to care for myself. So when I realized that I was getting that dry, scaly skin, I had the hair loss. I started researching herbal remedies, and that has been a huge change to this point. Now, for me, using the local healthcare system, in terms of getting thyroid medications, you get a generic type, and that doesn't do shit. It's as it is. I have to say it as it is. I'm not even going to be nice about it. If you're depending on the generic type of medication to do anything for you, if you have thyroid disease, you're not going to get any better. You may eventually die. So that's my experience. And when you go there, the doctors can be so brutal, so disrespectful if you do not know your own how to stand up for yourself. And it doesn't matter how you look. You could go there, be nice, be all classy. If you look nice, they're going to tell you that you can afford to pay for your health care. Like what one doctor did. She said that I'm being abusive because you're here all dressed nice and everything well spoken. Why didn't you go to a private doctor? And I'm saying, but there is this facility. I pay taxes more than most of these people who are here. Many of them are unemployed, and I am employed. I pay my taxes, so it's only fair that I get back something out of what I'm contributing to this country. This is a junior doctor, and she's telling me that I am being abusive, and I had to get down to work. I had to basically argue with her, put her in her place, and I said, you know what, I'm not going to stoop to this. Then another doctor stepped in and let her know that what she said was very much out of line, because Jamaica has an healthcare system. It doesn't have a classism system. And I really appreciate that doctor for stepping in and also put her in her place. So since then, that was my last day visiting the public government facility, because the doctors there, they're very disrespectful, very abusive. They don't know how to talk to people. And this is one of the main concern many Jamaicans are crying about, is the abuse from many of these doctors. Now, as it relates to persons who have cancer, who have HIV, I know for a fact that if you have cancer in Jamaica, the government is not going to do anything for you. The healthcare facility doesn't cover any of your medication. If you have any other terminal illnesses like brain disease, the free healthcare system in Jamaica will not do anything for anyone. These people have to be taking money out of pockets. So if you have Alzheimer's, if you have cancer, once you're terminally ill, you better get that money, you better get that support, because you will only go to the government facility to suffer and maybe even die earlier. If you're admitted in the hospital, you will get some amount of help. God forbid, pray that you have a decent doctor and decent nurses working while you're there, because some of them are so angry, some of them are so bitter that they are just rude, disrespectful, and abusive to the patients in these facilities. So based on that, and this is from experience from myself, other persons that I know that have gone through this. So based on that, I definitely believe that the healthcare system in Jamaica should not be entirely free. The government should revise this sector, look into it, because it really needs money to really flourish. People really do need help, but at the same time, we need more facilities. We need better doctors. We need better nurses. If it means that you are to give them more pay for them to treat the patients with respect and due care, if that is what needs to be done, it should be done, because when you're ill, whenever you're going through an illness, and if you go to these healthcare facility, chances are you may go to your grave quicker than how it was originally intended to happen, because the abuse at some of these facilities, not in all cases, just a few, it can be so horrific that it can take you to your grave even quicker than how it was originally intended to happen. So what I definitely think that the government should do is to revise the healthcare system, allow those who can pay to pay something, not just ask if you have a health card, because when I go, I do have a health card, and they'll ask, do you have a health card? And sometimes they don't even ask. I have to give them my health card in hopes that I may get a better treatment when I used to go. And I've said that, you know what, it's not worth it, because some of these places, they're not even clean. They're not even well kept. Where I'm from originally, that health facility is well kept. It's very clean. I'm not sure if it's because the Queen of England is still somewhat attached to that healthcare facility. For those of us who are from Jamaica, you may know what healthcare facility I'm talking about. So that healthcare facility, it has the Queen's name attached to it. So they're always sending equipments. They're always sending a representative out just to ensure that that healthcare facility is in tip-top condition. So when I go to my hometown, I get top class, superb experience. I'm treated with love. I'm treated with respect. The place is clean. The bathroom there is clean. It's so clean that you would almost think that you're at an hotel. But outside of where I'm from, the healthcare system is just so atrocious. You would not believe it. And oftentimes people do die because of these poor, lacking, well needed facilities that are not properly equipped. They're poorly maintained. So, based on that, I definitely think that the government needs to revise this healthcare system, have something in place that you demand some kind of payment. And for those of who genuinely cannot pay, they should not be refused healthcare. However, there should be someone doing some kind of background check proving that this person is unable to pay for their health care. So therefore, there will not be any charge to this person. And for those who can pay, even if they're not able to pay everything upfront all at once, they should make arrangements to pay at a later date so that we can have a better healthcare system, because at this time in Jamaica, our healthcare system is in crisis. And because of that, so many persons, they do not have any interest of seeking healthcare because they just can't be bothered. They think it's best that they stay home and die slowly rather than to go to these facilities that are free, and the experience might be so atrocious that they may die earlier than originally they should go. So that's just basically all I want to share with you guys about the healthcare system here in Jamaica. And definitely, I think it needs to be revised so that those of us who can afford to pay should pay, so that we can have a more sustainable, well equipped healthcare system, so that we can preserve health, preserve life in the long run. Thank you guys for your time, your energy. Stay safe, and see you guys next time. Bye, guys.